Hi, my name is Joseph Irizarry, and we're going to be going through an ankle and foot evaluation video today. I have my partner with me, Luis, and so we're just going to walk you through the steps of how that's done, all right? So what brings you in today?
I feel like some pain on the back part of my leg, my foot.
Okay, back part of your leg. So can you tell me what was going on, what happened when you heard it?
So I was playing and this guy fell on me. I had my leg out like this and I was planning down. I was about to push off, but he like pushed on me and I felt like a pop in the back of my foot in this area.
Okay, and is it, what sport do you play?
I play soccer.
Soccer?
Yeah, he just fell on me by accident.
Okay, and is it your right that's bothering you?
Yes, no, my left.
Left, okay. And how long ago did this happen?
This happened, yes, 2 days ago.
2 days ago.
Yesterday is like, it felt okay, but I just couldn't bring my toes up.
Okay.
Like that, and like bring my toes down. It just like hurt.
Okay, and did I notice when you came in, were you using crutches or a walking boot or anything like that?
No, you just saw me limping.
Just limping? Okay. Alright, and after the initial incident happened, if you could rate the pain for me, scale 1 to 10. 10 being going to the hospital right now, 5 being it kind of just alters the way you move a little bit.
It was about 8, 9.
8?
It was pretty bad. Yeah.
Really bad at the time?
Yeah.
Now as you sit here right now, how would you rate the pain?
Here is nothing. Like there's like this comfort, but it's like tolerable. It's not until like I start trying to walk, that's when it starts like hurting.
Okay, so if you're just kind of in a relaxed position, you don't feel a lot of pain?
No, it's just like, it's there, but it's nothing to like, you know.
Okay, and you said you felt a pop?
Yes, I did.
Okay, have you ever had any history of not just ankle issues, any previous injury history?
No, I remember like in high school, I would have like kind of like ankle sprains, stuff like that. But I mean, that's all I could think of. I would also have like pain in the back of my in that area where it happened, but
Okay.
it wasn't like that bad. That's why I thought it felt the same, so I didn't I don't know, think of
Okay, and did you ever, did you have a ATC at your high school?
No.
Okay, and back then you just ice it and kind of...
Yeah, it just like went along with it. After a while it went away, but
Alright, so since the first incident, recently when you were playing the game, any ice, any ibuprofen, anything like that?
no, it's just like I left it on and I just thought it would be okay until I
Okay.
right now.
Alright, and do you feel, so the pains you said is in the back of your ankle,
Yeah.
so you can take one finger, show where the pain's bothering you.
It just hurts in this area, like right here.
Okay. And you said it doesn't bother you until you start to walk.
Yeah.
When you do try to walk, do you feel any pain does the pain radiate up into the leg or anywhere down towards your toe?
No, just there.
Any numbness, tingling, brain?
No.
Okay. And so, is there anything other than sitting that alleviates it? Like, how does it feel when you sleep at night?
I mean, it feels like whatever, nothing really, to it. I mean, I just sleep through it, just wake up, and just like it hurts, but sometimes it's like it goes away, but then it comes back.
Okay.
Little moderations of like sharp pain.
Okay. And then, in terms of getting ready for your day, going out to class or things like that, any pain, discomfort, you have to change how you do stuff and do that?
Just when I walk around.
Like you walk around? Okay. And so now I'm going to go into do some observations with them. And so I'm just going to kind of make some note of some things that I see. First thing I'm going to be looking for is obvious deformities, swelling, discoloration. I'm going to have him see if I can have him stand up and look at how he sets his feet posture-wise. See if maybe I can have him walk a little bit. See how that alters things a little bit, and we're going to go from there. So going into observations, looking at both of your ankles. Do I notice any swelling, discoloration on the affected side?
Yes, you notice the swelling. You notice that there is a divot, some abnormalities to it, and the temperature change.
Okay, and it's all located on that posterior side?
Yes.
Okay. Now I'm just kind of looking at placement, looking at comparatively. You see that there's a little bit of a divot. Is there anything like that on the unaffected side that would be considered normal for you?
No.
No? Okay. So, going through the observation aspect of it, there is swelling, discoloration, and deformity that I can see on the injured side. Just checking with the divot that I see on the unaffected side, see if maybe that may be just normal for him. That's not present, so obviously that's an abnormality that I'm going to take note of. Would you mind go ahead and just trying to stand up for me? I know it says it's kind of painful, but mind go ahead and try to take a shot for me?
Thinking of what?
Take a shot. All right, so I noticed obviously you kind of favor that side, try to not put as much pressure on it. So now, how do you feel, pain scale wise, as you stand here?
It's just like whatever.
Never?
It's just there. It's there.
Okay. Would you mind trying to take a few steps for you, see how that feels for you?
That hurts. I can't like plant down. I have to like walk it this way.
Okay. Go ahead and just come back for me real quick. All right. And just relax there. Okay, so obviously just kind of observing how he tries to walk, what kind of compensations he makes. His foot stays in a locked position. He doesn't point his toes down. So just kind of going off of what I've seen and what I've asked him about, the first things that come to mind is an Achilles. Like either he's mentioned that he's had pain there before, so he could have tendonitis or a degenerative condition over time, which has led to maybe an Achilles tendon rupture, which explains the deformity. There also could be maybe a fracture of the calcaneus present. During the activity, he could have had an avulsion fracture, maybe that could be causing some pain and some of that swelling as well. So I'm going to rule out those with my palpations and do some tests to rule out fractures, and then I'm going to jump into some MMTs and other tests to see if it's truly an Achilles tendon rupture. So go ahead and just take a seat for me real quick. So just going into some general palpations. Any pain down here by the toes?
No.
No? Any pain as I go kind of up here in kind of like the middle of your foot?
No.
Any pain there?
Just on the back part.
Right there? That's, if I put pressure on it now, does that bother you?
Yeah.
Okay. Any pain here?
Nothing.
There?
Nothing.
Alright. So just kind of now, I just went through and just kind of to see, gauge where he's feeling pain. I went through some palpations, also feeling any false movement, anything else, just to check, to make sure that nothing else could be going wrong as well, any mechanics of the feet that are causing this issue. Everything seems to be normal. No pain except for the posterior aspect around the Achilles. So now I'm just going to do some quick tests just to rule out fractures. Just do some squeeze and compression here. Any pain with that at all?
Just like on the back.
In the back, okay.
I mean, just some discomfort, but
Okay. So the fact that those didn't really bother him too much, he didn't flinch, didn't have any sudden reactions of pain, with those tests helps me kind of rule out the fact that there could be a fracture present. So now I'm going to focus more on the Achilles tendon part of it. So we're going to do a couple of tests real quick. For all of these tests, I'm going to have you laying on your stomach on this table. Is that okay?
sure.
So go ahead and lay on your stomach for me and have your feet off to the side. So what I'm going to do is I'm going to passively bring him up a little bit past 90, and I'm going to be testing his bladder flexors because the gastroc and the soleus are part of that. Now when I have him at 90 here, I'm taking out the gastroc and I'm focusing more on the soleus aspect. So I'm going to kind of grab around here, and I'm going to instruct you to act like you're pushing down on the gas pedal. I'm going to just go ahead and do that motion just to get used to it. Can you do that at all?
Okay.
No?
No.
Okay. Since he can't really do that, there's nothing really there. We got to kind of bring the hamstrings into it, see if there's any difference with this. So go ahead and once again act like you're pushing on the gas pedal.
There's like some, but I can't like all the way.
Okay. Well, since he's having trouble activating the gastroc in either position, that's a positive in terms of looking at an Achilles tendon injury. So the last thing I'm going to do is called Thompson's test, and I'm going to have him in the same position for this. And all you do is when they're relaxed and laying on their stomach, you just squeeze the belly of the gastroc. And I noticed there is a little bit of swelling and discoloration kind of working the way up the leg, which is another thing that could be indicative of a rupture of the Achilles. But all you're going to do is find the belly of the gastroc and you're just going to squeeze it. And if there's Achilles tendons intact, you'll see a little bit of plantar flexion happen. You'll see the toes move a little bit. So I'm going to look to see if I have any action with the toes. And there's not really much going on when I squeeze it. You go ahead and sit up for me. Okay, so going through those tests, going through a couple of squeeze tests, bump tests, rule out the possibility of an avulsion fracture. No real discomfort with that, so that clears that up. Moving then into a muscular injury, worrying about an Achilles tendon issue, especially since he's described that he's had pain there in the past. Both MMT tests for plantar flexors with the gastroc involved and with the gastroc not involved, the patient was unable to even passively produce any movement, so I wasn't going to be able to even test the muscle if he can't even do it passively. And then I went into Thompson test just to do some squeeze and to see if I had any activation there, and no activation was present. So based off of those tests being positive and all the fracture tests being negative, I feel confident saying that it is not a fracture, but I do believe you have an Achilles tendon rupture. There are two ways to treat this. We can go in a conservative route, or we can go a more aggressive approach. I feel like the best idea for you is to take a more aggressive approach. We're probably going to go with a surgical approach for you. That way we can get you in for a surgery, have that repaired, and then once you get out of surgery, we can make sure that we don't lose range of motion, because you already have range of motion compromised because of the injury. You don't have any plantar flexion. So we're going to make sure that we build back up that range of motion a little bit, work slowly, but I feel like that'll be overall the best idea to get your strength back, range of motion back, and get you back out on the field. So that's my ankle and foot evaluation video. Thank you very much.